Okay, so my things are kind of out of the package because I've already been practicing most of the morning. Something I learned, it's way easier to draw up an injection for a horse than it is with these needles, because I just stick the needle in. It's not that hard. Anyway, it's not the point. You're gonna wanna have your syringe. We're using a 3 milliliter because that's what we need. Mine's out of the package. You would probably keep it in the package. Gonna have my cap on this, which those don't go back on either. Which is weird because I thought you could pop them back on. Anyways, so you're also gonna wanna have your needle. We all just got blunt tip needles, but you're gonna wanna check your gauge and stuff like that. So if it's a thicker medication, you might need to use a larger gauge, or depending on where you're pulling from, if you're not pulling from a vial, if you're pulling from an Amtol, you're gonna wanna use a different type of needle as well. You're gonna wanna identify what site you're gonna give it in. So we're doing an IM injection, so you're either gonna wanna go right here, which is gonna, it's really hard to do this on myself. So you're pretty much gonna like determine where your deltoid muscle is, and you're gonna go you're gonna wanna go on a V for that. Like you're gonna wanna get, there's a triangle right about here, which is determined by figuring out where your scapula is and your other muscles, and you're just gonna kind of want to go right in that V. And when you do that, you're gonna want to kind of pull the skin out, just tighten it up on that muscle, and at a 90-degree angle. Some IM injections do have a different angle. Not all of them are 90, but yeah, for the most part, you're just gonna wanna go in 90-degree angle. You're gonna wanna have an alcohol wipe, as I'm still over here, like, you're gonna wanna have an alcohol wipe prepared for that, because you're gonna wanna clean that site. You're also going to wanna have another one for your vial. You're also gonna wanna have your sharps container in reach. You're gonna wanna have your orders, because you wanna check those like as many times as you possibly can, preferably at least 3. You're gonna wanna check your patient to make sure it's the correct patient. These are all things that you have to keep in mind when giving any injection, not just an IM injection. Another site that you could do is, I'm not gonna stand up and show you, I'm just gonna tell you. It's gonna be like right above, like right where the hip bone's at. And that one you're gonna wanna use these fingers to just determine where that gluteus medius is, and again, just a 90-degree angle. That's gonna be another really common one. You can also give them in the gluteus maximus. They just, they kind of stopped doing that as much. They don't give them just like in the butt anymore. They mostly do like the hip or the deltoid are gonna be preferred injection sites. And with all of those, you're gonna wanna kind of hold the skin tight, and then after you get that injection placed in, you're gonna let it kind of slowly come back together. That just helps that medication stay in, all of those things. But yeah, anyways, those are the things you need to focus on, you need to know. You're gonna wanna obtain your medication. So I have a 10 milliliter bottle of saline. I'm gonna take this cap off. At this point, once I take that cap off, I'm gonna have my, I got saline all over my blanket. I'm gonna wanna have my non-sterile gloves on. My hands should be clean before I open any of these things. I am going to have my syringe ready. The inside of my syringe is gonna be sterile, so I'm not super worried about the rest of it. However, I do want to, once I open my needle, I don't want to touch that because I still want all of that to stay sterile and clean. I'm gonna want to just screw that on there. This is a Luer Lock syringe, so That's what that is called. I'm gonna get that out. I'm going to wipe this down with alcohol before I put my syringe in there. At this point, I'm prepared to remove my tip. Before I put the, or I mean, you can do it now too, I guess. Before I take this off though, preferably before I put the needle on, I just kind of wasn't, I was talking and kind of slipped my memory. You're gonna wanna draw up the amount of air that you want to go back in here so you can get that shot drawn up. I prefer to hold mine kind of like this and then do it. Especially with these 10 milliliter bottles, like there's just not a whole lot of space. But you're gonna wanna check for any abnormalities and stuff like that too. So just go ahead and get your thing off. Try not to touch anything. Stick that in there, put your air in, and then you're gonna be ready to draw up your, I had an air bubble in here from earlier. So, there we go, I've got my 1 milliliter in. I'm gonna immediately put my lid back on. And like I said, I had air in here from practicing it earlier. In the case that you do get air, you don't want to inject that into the muscle. It can cause irritation. I can't get this bubble to come up, but you should just be able to flick it. That bubble should come up, and you're just gonna kind of get it out and ready. But like I said, I can't get this one to come out. Weird. Anyways, yeah, that's me drawing up some saline.